Now the pharynx, it is a musculofibrous structure or a tube which is present on the posterior side of the nasal area, the oral area and the larynx. This pharynx is approximately like 12 to 15 centimeters long, and it extends, this is the sphenoid. It extends from the body of the sphenoid, it extends from the basal part of the occipital bone, and then goes downwards up till the lower border of the cricoid cartilage, which basically corresponds to the 6th cervical vertebra. So the pharynx, which extends, which is approximately 12 to 15 centimeters long, extends from the base of the body of the sphenoid and the basal part of the occipital bone, goes downwards up till the lower part of the cricoid cartilage, which is basically opposite the 6th cervical vertebra. Now this pharynx, anterior wall of the pharynx is deficient, and this pharynx basically communicates anteriorly with the nasal cavity through the posterior nasal aperture, which is also known as the cone. So anteriorly, the pharynx communicates with the nasal cavity through the cone, and this area is basically known as the nasopharynx. On the middle part, you can see over here, the pharynx anteriorly communicates with the oral cavity, and this basic area is known as the oropharynx. So this is the nasopharynx, this is the oropharynx, and posteriorly and downward, if we go to the downward area, now here you can see that anteriorly the pharynx communicates with the larynx through this laryngeal inlet. So this area is basically known as the laryngopharynx. So the pharynx is divided into three parts: the nasopharynx, the oropharynx, and the laryngopharynx. Now let's look one by one. On the posterior part, we basically have the prevertebral fascia along with the muscles, and then the vertebrae, that is up till the C6 vertebra. Now let's look at the nasopharynx. The nasopharynx extends from the body of the sphenoid and the basal part of the occipital bone up till the lower section in the soft palate. On the roof of the nasopharynx, or the roof of the nasopharynx, is formed again by the body of the sphenoid, the basal part of the occipital bone, and the arch of the atlas. On the roof, lymphoid aggregations, which are basically known as the nasopharyngeal tonsils. The mucosal area, or the mucosa, which covers the topmost layer or the roof, has lymphoid follicles present, and these aggregations of lymphoid tissues are known as nasopharyngeal tonsils. When the nasopharyngeal tonsils gets inflamed, this condition is known as adenoids, and if this gets enlarged, nasal breathing is prevented and oral breathing takes place. On the posterior wall, on the lateral wall, here you can see the presence of a tube, right? We can see the presence of an opening. This opening is known as the eustachian tube or the pharyngotympanic tube. The place where the forceps has gone, this is the tube, the auditory tube or the eustachian tube or the pharyngotympanic tube. Now the main function of this pharyngotympanic tube is to maintain the pressure in the tympanic cavity and the nasopharyngeal area. Now just above this auditory tube, you can see that there is an elevation. Now this elevation is known as the tubal elevation, and lying inside the mucosa of the tubal elevation, we are again going to have the lymphoid tissues, which will be known as the tubal tonsils. So here we have two different kinds of tonsils. On the roof, we will have the nasopharyngeal tonsils, and on the elevation known as the tubal elevation, we are going to have the tubal tonsils. From this tubal elevation, you can see that there is a fold which is coming downwards. This fold is known as the salpingopharyngeal fold. This is the salpingopharyngeal fold, and the fold which is going on the front, this is known as the salpingopalatine fold. Alright, so these are the two folds which are going to go backwards as well as on the anterior part. The inferior part of the nasopharynx communicates with the oropharynx at this level, and this portion is basically known as the right? This is the pharyngeal isthmus. This pharyngeal isthmus on the posterior part, with the help of the sphincteric muscles of the palatopharyngeus, forms a constricted area over here, sphincteric area, which is known as the Passavant's ridge. All right, now let's come to the oropharynx. The oropharynx extends from the soft palate up till the upper border of the epiglottis, right? It extends from the soft palate up till the upper border of the epiglottis. Now on the lateral wall, if I remove, you can see a fold, this one. This fold is known as the palatoglossal arch. We have dissected a little bit, so you cannot see the arch properly, but this is the the palatoglossal arch. This palatoglossal arch is a mucosal arch which covers the palatoglossus muscle. Posteriorly, you can see one more fold, this one, which is going towards the pharyngeal area. This is the palatopharyngeal fold or the palatopharyngeal arch. And this mucosal arch has the muscle known as the palatopharyngeus muscle. In between the two arches, the palatoglossal arch and the palatopharyngeal arch, we are going to have the palatine tonsils. So this area is of the palatine tonsillar area or the tonsillar fossa. So the tonsillar fossa is bounded anteriorly by this palatoglossal arch, also known as the anterior pillar of fossae. Posteriorly, it is bounded by the palatopharyngeal arch, also known as the posterior pillar of the fossae. The apex of the fossa is on the palate, where both the arches are going to meet. Right? So this is about the lateral wall. Now, the anterior part of the oropharynx is bounded by this posterior part of the tongue, where you can see again many tissues or many lymphoid aggregations. These are known as the lingual tonsils. So till now we have seen the nasopharyngeal tonsils, the tubal tonsils, the palatine tonsils, and the lingual tonsils. So together, if the whole face would have been present, together all these tonsils are going to form a ring-like structure, which is known as the Weldeyer's lymphatic ring. So the Weldeyer's lymphatic ring is formed by the nasopharyngeal tonsils, the tubal tonsils, the lingual tonsils, and the largest one, the palatine tonsils. So this structure forms the ring, which is basically known as the Weldeyer's lymphatic ring. Now, on the inferior part, the next structure that we have to study is the nasopharynx. So the nasopharynx extends from the upper border of the epiglottis and goes downwards up till the lower border of the cricoid cartilage. This is the cricoid cartilage. Now don't get confused. Cricoid cartilage, the lamina, it is larger on the posterior surface, whereas the thyroid cartilage is on the anterior part. So this is the thyroid cartilage and this is the cricoid cartilage. This is the cricoid cartilage. Both the structure that you can see, this is the cricoid cartilage. The cricoid cartilage is a ring-like structure and the larger part is present on the posterior aspect. So the laryngopharynx extends from the upper border of the epiglottis up till the lower border of the cricoid cartilage. On the laryngopharynx, this pharyngeal area basically communicates to the larynx by this opening, which is known as the laryngeal inlet. So the laryngeal inlet is basically bounded on the upper part by the epiglottis, on the medial side by the aryepiglottic folds. These are the aryepiglottic folds. And on the lower side, it will be bounded by the interarytenoid folds. Right? So these are the boundaries of the laryngeal inlet. On the posterior part of this larynx, if you can see this area, this is the piriform fossa. This is the piriform fossa. This piriform fossa has boundaries, the lateral boundary, which the forceps I am pointing over here, this is the lateral boundary. The lateral boundary of the piriform fossa is formed by the mucosa, which is covering the lamina of the thyroid cartilage. On the middle side, we are going to have this fold. This is the aryepiglottic fold. Ary means the arytenoid cartilage, which is present over here, right? The arytenoid cartilage and the epiglottics. This is also a cartilage. So the fold present between the epiglottis and the arytenoid is known as the aryepiglottic fold. So medially, the piriform fossa is bounded by the aryepiglottic fold. On the upper part, you can see we have one fold, this one, this fold. This fold is basically known as the lateral glossoepiglottic fold. This is the medial glossoepiglottic fold, and this is the lateral glossoepiglottic fold. This lateral glossoepiglottic fold and the medial epiglottic fold, in between them, here you can see a space. This space is known as the vallecula. Now, this piriform fossa in the ruminating animals, when the laryngeal inlet closes, this piriform fossa acts as a lateral footway passage. This laryngeal, the piriform fossa, if you remember that there is an artery and a nerve which pierces the thyroid membrane, the superior laryngeal artery, which is a branch of the superior thyroid artery, along with the internal laryngeal nerve, which comes from the superior laryngeal nerve, they both pierces the thyroid membrane and comes here and supply this mucosal area of the piriform fossa. Now this area is also been used by smugglers for smuggling diamonds and precious stones. That is why this fossa is also known as the smuggler's fossa. This pouch is also known as the smuggler's fossa, where they hide their precious stones like the diamonds and the gems, which they can later on bring it out. On the larynx, this gap that you can see is known as the glottis. The upper part is known as the supraglottic area, and the lower part is known as the infraglottic area. This supraglottic area has this fold, which is known as the false vocal folds, also known as the vestibular fold, and the lower one, this one, is the true vocal folds. These are the vocal ligaments, which has the muscle that is the vocalis muscle. Now, if I take my forceps, now if you can see the forceps, the pin forceps, here on the glottis, you can see that the forceps is going upwards, right? Now if you can see over here, if I am inserting the forceps, you can see that the forceps has gone upwards. See, the forceps has gone over here. This is the saccule of the larynx. Now yesterday we have discussed that this area is very rich in mucus gland, and it secretes, and it basically keeps the vocal area moist. So this area, that is the saccule, releases sebaceous structures. That is why this saccule is also known as the oil can of the larynx. So if anyone asks you what do you understand by the oil can of the larynx, this structure, the saccule, is known as the oil can of the larynx, which basically goes upwards from the glottic area. This is present on the lateral part. So this is the saccule. The supraglottic part is supplied by the internal laryngeal nerve, and the infraglottic part will be supplied by the recurrent laryngeal nerve. So we have discussed about the lateral wall of the nose, the nasal area, the hard palate. This is the alveolar arch coming from the maxilla. We will also have contribution from the horizontal plate of the palatine bone. Then we have the soft palate. The soft palate, here you can see that the inferior portion, the inferior border, extends downwards and forms an extension which is known as the uvula. This is known as the uvula. This is the mandible, right? This is the mandible. Here we have the tongue and the muscles of the tongue. This is known as the genioglossus muscle. Okay, this is the geniohyoid muscle, and here these are the fibers of the mylohyoid muscle. So the geniohyoid muscle and the mylohyoid muscle.